Hi, everyone. Welcome to today's webinar, Improve Workforce Recruitment, Hiring, and Retention, Become a National Health Service Corps site. We're very excited for today's content. Okay, next slide, please. We are the School-Based Health Alliance, and we work to improve the health of children and youth by advancing and advocating for school-based health care. We believe all children and adolescents deserve to thrive, but too many struggle because they lack access to healthcare services. School-based healthcare is the solution, bringing healthcare to where students already spend a majority of their time in school. At the School-Based Health Alliance, we worked for over 25 years to set the national policy and legislative agenda for the field, advocate for greater support and funding, promote high-quality clinical practices and standards, support data collection, reporting, evaluation, and research, and provide training, technical assistance, and consultation. Next slide, please. We believe in the transformational power of health and education intersection. We believe school-based healthcare is a powerful tool for achieving health equity among children and adolescents who unjustly experience disparities in outcomes simply because of their race, ethnicity, disparities in outcomes, race, ethnicity, or family income. It's also common sense idea gaining currency across the country. Place critically needed services like medical, behavioral, dental, and vision care directly in schools. So all young people, no matter their zip code, have equal opportunity to learn and grow. Just a few housekeeping reminders for today. We are on Zoom webinar, so all attendees are in listen-only mode. Please feel free to add any questions to the Q&A icon at the bottom of your Zoom control panel. I'll jump back on at the end of the webinar today to go ahead and facilitate a Q&A section. The webinar is being recorded, and the recording will be shared with attendees and available on our website. If you want to turn on the closed captioning, please click on the CC button. And please complete our evaluation poll at the end of the presentation. We'd really appreciate it. It just takes about a minute. For today's objectives, attendees will have a strong grasp of the National Health Service Corps' mission and programs, know where to find information about the National Health Service Corps' various programs, and understand the benefits of applying to become a site and how to do so. And I'm pleased to welcome today's presenter. Captain No is the Regional Supervisor for the Bureau of Health Workforce Division of Regional Operations in Region 10. That's based in Seattle. He has served in this capacity since 2016 to support the Bureau of Health Workforce Programs and National Health Service Corps sites and participants. Captain No has nearly 20 years of experience in health administration, serving in various leadership positions since 2003. Now I'm going to pass it over to Captain No. Thank you.
Great, thank you. Thanks everyone for being here. I'm so pleased to be here to present this information to you. And thanks to the School-Based Health Alliance for hosting this webinar. I myself have two kids who are school aged, and so I'm very happy to be here to share information and resources with you that will help your community. Next slide, please. Thank you. So I'm Captain Kang No, and I'm here to tell you about the National Health Service Corps, known as the NHSC, and how it can benefit you to become an NHSC site. First, I'd like to start by telling you about our agency, the Health Resources and Services Administration, or HRSA, and my division, the HRSA Bureau of Health Workforce. HRSA supports more than 90 programs that provide healthcare to people who are geographically isolated, economically or medically vulnerable. HRSA does this through grants and cooperative agreements to more than 3,000 awardees, both public and private entities at local, state, tribal, and federal levels of government. And every year, HRSA programs serve millions of people, including people living with HIV/AIDS, pregnant women, mothers and their families, and those otherwise unable to access quality health care. Next slide, please. Now, within the Bureau of Health Workforce specifically, BHW improves the health of underserved populations by strengthening the health workforce and connecting skilled professionals to communities in need. We approach our grant awards and programs as a continuum of education, training, and service. And following this approach, we work to create a well-distributed and robust workforce supply of diverse, culturally competent health professionals who provide quality healthcare in high-need areas of the U.S. and its territories. Specifically, our scholarship and loan repayment programs help underserved communities recruit and retain primary health care providers. And I just want to make a note here that we are dropping links in the chat box for your convenience as well. This past year, the NHSC celebrated its 50th anniversary to build healthy communities by supporting qualified healthcare providers dedicated to working in areas with limited access to primary healthcare, regular dental and behavioral healthcare, and preventive screenings. To improve access to these crucial services by practicing in high professional shortage areas across the country, and to help clinicians pay off their health professional student loan debt in exchange for their service in high need areas through scholarships and loan repayment programs. The National Health Service Corps has programs that adapt to meet evolving public health needs, address identified health shortages by incentivizing service in areas where clinician supply is limited, and support qualified clinicians providing quality healthcare in these high need areas. The NHSC is an integral part of BHW's plan to overcome obstacles to access, supply, distribution, and quality of primary healthcare. Next slide, please. Here is a look at our various programs, numbers of applications and awards, including the combined loan repayment programs, student to service, state loan repayment program, and scholarship programs. I'll be telling you more about these programs as we move on. Next slide, please. And here's our impact. At historic funding levels in 2021 and 2022, we awarded every eligible applicant, making this our largest class of clinicians ever, with more than 20,000 NHSC members currently providing care to almost 21 million people in the US. Next slide, please. So with that brief highlight of HRSA and the NHSC, let's talk about today's goal and agenda. The goal of this webinar is to encourage eligible school-based health centers that are not National Health Service Corps sites to apply to become NHSC approved, and to show you how this can improve recruitment, hiring, and retention of skilled healthcare providers. In our remaining time together, let's discuss NHSC programs and sites, support and resources, and close out with how to connect with HRSA and answer some of your questions. Next slide, please. So let us now take a deeper dive into each program under the NHSC umbrella. I have quite a bit of details to share regarding the 6 programs on this slide, so please bear with me. Working our way down on the left side of the slide, first, the NHSC Loan Repayment Program offers up to $50,000 to repay health profession student loans in exchange for a 2-year commitment to work at an NHSC-approved site in a high-need, underserved area. Next, the NHSC SUD Workforce LRP. To combat the nation's opioid crisis, HRSA launched the NHSC Substance Use Disorder Workforce Loan Repayment Program. The program supports the recruitment and retention of health professionals needed to improve access to substance use disorder treatment across the country, strengthens the country's behavioral health workforce, and benefits communities in need of these services. Awardees receive up to $75,000 to repay their health profession student loans in exchange for a 3-year commitment to work at an NHSC-approved substance use disorder site in a high-need, underserved area. Third, the Rural Community Loan Repayment Program, or Rural Community LRP. This is a partnership with the Rural Communities Opioid Response Program, or RCOR, which provides dedicated funding for rural communities impacted by high overdose rates, as identified by the Federal Office of Rural Health Policy. The program supports the recruitment and retention of health professionals needed to access substance use disorder treatment in high-need rural communities across the nation, and strengthens the country's behavioral health workforce. The NHSC Rural Community LRP provides up to $100,000 in student loan repayment in exchange for a 3-year service commitment to practice within the most vulnerable, high-risk rural counties in America. Next is the NHSC Scholarship Program on the upper right side of the slide. The NHSC Scholarship Program pays tuition and other expenses for students pursuing primary care careers. When they graduate, they go on to serve in underserved, high-need rural and urban communities. The following disciplines are eligible for the NHSC Scholarship Program: physicians, MDs or DOs, dentists, DMDs or DDSs, nurse practitioners, certified nurse midwives, physician assistants. Scholarship support includes tax-free payment of tuition, required fees, other reasonable educational costs, and a monthly living stipend that's taxable. For 1 year of financial support, a scholarship recipient serves a minimum of 2 years at an NHSC-approved site in a high-need urban, rural, or frontier community across the nation. For each additional year of support, up to 4 years, a scholar serves a 1-year obligation. Scholarship recipients who remain at an NHSC site after completing their service and have remaining eligible debt can apply to the NHSC Loan Repayment Program. The fifth program is the NHSC Students to Service, or S2S Loan Repayment Program. The S2S Loan Repayment Program provides up to $120,000 to medical or dental students in their final year of school in return for a commitment to provide care to underserved populations at NHSC-approved sites across the country. To be eligible for the S2S LRP, you must be enrolled as a full-time student in the final year of medical or dental school and be attending a fully accredited school in an eligible degree program. Where for medical students must complete an accredited primary care residency in an NHSC-approved specialty, dental students are encouraged but not required to complete accredited postgraduate training in an NHSC-approved specialty. S2S recipients are eligible to apply for the NHSC's loan repayment program if they have remaining qualifying student debt and continue to work at an NHSC-approved site. And lastly, NHSC State Loan Repayment Program, or SLRP. The State Loan Repayment Program provides cost-sharing grants to states and territories to operate their loan repayment programs. The grants to states are awarded for a 4-year period. In FY 2022, we awarded 46 states, Washington, D.C., and three U.S. territories, Northern Mariana Islands, Guam, and the U.S. Virgin Islands, almost $100 million in grants in the current project period that began in September 2022 and runs through 2025 to fund loan repayment programs. These state-run programs offer loan repayment to primary medical, mental behavioral, and dental health care clinicians working in health professional shortage areas, or HPSAs. Eligible disciplines, practice sites, length of required service commitment, and the amount of loan repayment awards offered may differ by state or territory. That was a lot of information, but don't worry, all of this information can be found on the NHSC website, as well as all of the links that are being dropped in the chat box. Next slide, please. Now let's move on to talk about NHSC sites, but before I give you an overview, I'd like to share a short video to give you some context called Become an NHSC Approved Site. Thanks for your patience while we get the video going.
For more than 50 years, National Health Service Corps has been essential to building healthy communities by connecting providers to areas that need them most and thousands of NHSC-approved sites have been an integral part of our success in serving communities, increasing health equity, and providing culturally competent care regardless of patients' ability to pay.
This program is so critical for the ability of underserved communities to bring people in. Without the National Health Service Corps, our shortage in primary care would be that much greater.
And by employing providers who receive National Health Service Corps loan repayment and scholarship awards, our sites also support providers.
I don't know how we would be able to do it in this day and age without the National Health Service Corps in terms of helping to support our clinicians who are coming out of education with so much debt.
HRSA is thankful for NHSC-approved sites who help us provide access to care for millions of patients nationwide. Learn more about the benefits of becoming an NHSC-approved site at nhsc.hrsa.gov/sites.
Well, thank you for watching that video. That's a really wonderful and inspiring video, and it makes me be thankful for the job that I love to do every day. So thank you. I hope the video gave you a good foundation for hearing more about becoming an NHSC site. Sorry about that. So let me begin by saying that all NHSC clinicians must work at an NHSC approved site. A National Health Service Corps approved site is a healthcare facility that generally provides comprehensive outpatient primary medical healthcare, dental healthcare, or mental health services to populations residing in health professional shortage areas, and has been determined to meet the NHSC site eligibility requirements and qualifications. The facility may be located in a rural, urban, or tribal community. To apply to become an NHSC site, the facility must meet applicable requirements that are aligned with the NHSC site agreement. For example, the site must be an eligible site type, provide comprehensive care, and offer a sliding fee discount program. To locate the requirements, please review the website for the most updated information regarding requirements and to view the NHSC site agreement. Next slide, please. So here you see a listing of eligible site types. You will notice that the list includes both school-based programs as part of federally qualified health centers, as well as standalone school-based clinics. And I'll give you a moment to scan this list. Next slide, please. This is a further breakdown of site types by whether the site is eligible for auto approval or sites that must submit applications and recertifications during open cycles. Of note regarding school-based clinics, NHSC participants working at school-based clinics that are not open for at least 45 weeks per year can work at additional NHSC-approved sites to meet the NHSC's clinical practice requirements. The additional NHSC-approved sites must satisfy the participant's program HPSA requirements. If the NHSC participant does not have an alternate NHSC-approved site to fulfill their clinical practice requirements, we will then extend the participant service obligation to account for the time when the school is closed. Next slide, please. In addition to the list of eligible NHSC site types, I did want to take a moment to draw your attention to the various types of SUD eligible treatment facilities. Please note that these are technically not separate SUD site types, but rather NHSC site types that offer SUD services. Again, you will notice that school-based clinics are among the types of sites that can provide SUD services and thus are eligible to hire clinicians who receive funding from our SUD LRPs. Next slide, please. Let's spend a few minutes talking about the NHSC site application process for both non-auto-approved site types and eligible auto-approved sites. In order to submit an NHSC site application, sites must utilize the BHW Customer Service Portal. Next slide, please. We encourage eligible school-based health centers to apply to become an NHSC site. If you're not sure whether your site is NHSC approved, you can sign into our Health Workforce Connector to check. Later in this presentation, I'll tell you more about the Health Workforce Connector. In the meantime, our communication staff have dropped a link to the Health Workforce Connector in the chat. Here are a few important points about the NHSC site application cycle. It's important to note that the NHSC new site application cycle is open now through Thursday, June 22nd at 11:59 p.m. Eastern Time. This cycle is for sites that have never been approved for NHSC, including sites that have applied and had their application denied or canceled. This cycle is also for sites that are currently inactive for NHSC due to expiration or past compliance issues. And as a note, I do want to put in a plug for the upcoming May 25th Q&A session. The recertification cycle. This cycle normally opens in the fall, is for active NHSC sites with an expiration date corresponding to the open recertification application cycle. So for example, this year, this cycle would be for sites with an expiration date of December 31st, 2023. With the exception of auto-approved NHSC site types, the NHSC site application approval is valid for 3 years from the date of its approval, as long as the site remains in and serves a HPSA and continues to meet the NHSC eligibility requirements and qualification factors. Next slide, please. On this slide, you see the sections of an NHSC site application on the BHW program portal. Non-auto-approved sites will need to complete all sections of the site application. For eligible auto-approved sites, there are sections that are grayed out to align with exemptions of certain requirements, such as completion of the NHSC site data tables as part of Section 4, Services and Staffing, and Section 6, Payments and Insurance section, and completion of the NHSC Behavioral Health Checklist as part of Section 5, Behavioral Health. All sites need to review the NHSC site agreement and sign off on the application prior to submission. Next slide, please. We highly encourage all site points of contact to thoroughly review the NHSC site reference guide prior to application. And when you're ready to apply, log into your BHW Customer Service Portal account or create one. And for help with your application, please look at the links we're posting in the chat throughout the webinar to find information about the new site application toolkit, new site application webinar, the Spanish and English Q&A session coming up on May 25th, and other helpful resources. We'll also forward a list of these resources to SBHA to share with you after today's webinar. Next slide, please. As mentioned previously, certain site types are eligible for auto approval and can request NHSC site approval at any time. To determine whether your site or the site where you work is eligible for auto approval, visit the Auto Approved NHSC Sites webpage. Sites that are not eligible for auto approval but meet NHSC requirements need to apply during the annual NHSC new site application cycle, which, as I mentioned before, is open now through Thursday, June 22nd, 2023 at 11:59 p.m. Eastern Time. In a similar process to non-auto approved sites, the site point of contact would need to log into the BHW Customer Service Portal, select the site name or create a new site if it's not already listed, and complete the site application. These sites would still need to review and sign the NHSC site agreement and submit the site application for approval. However, please note that new this year, eligible auto-approved sites are not required to submit documentation during the site application process. And as a reminder, auto-approved sites do not need to submit site recertifications. Next slide, please. This is a look at the support that my division, the Division of Regional Operations provides to both sites and clinicians. You'll see that we have dedicated staff located in all 10 HHS regional offices. To contact your regional office, state, or territorial lead, please visit the NHSC website. Next slide, please. Now, as mentioned earlier, a great resource at your disposal is the Health Workforce Connector. Here, clinicians can create profiles and search for jobs in underserved areas throughout the country. And with these profiles, sites can search job seekers by location, field of practice, discipline, specialty, state licensure, languages spoken, preferred work schedule. Next slide, please. Likewise, NHSC and Nurse Corps sites can create profiles and post job vacancies. And this then would allow job seekers to search sites by location, field of practice, discipline, specialty, HPSA score, services provided, sites with open positions, and zip code. The Health Workforce Connector profile is also an opportunity for sites to add information about their community to showcase their site. Next slide, please. Sites and clinicians will also benefit from participating in our virtual job fairs. Virtual job fairs offer an innovative way for NHSC and Nurse Corps approved sites to promote job opportunities to a targeted audience of primary care clinicians who are interested in serving communities with limited access to healthcare. Benefits of a virtual job fair include sites advertised to a wider audience, connections are made virtually with no travel costs, clinicians connect with sites targeted areas where they are looking to work, clinicians explore jobs at sites they may not have been aware of for consideration, and both job seekers and sites are provided technical assistance on using the Health Workforce Connector. Next slide, please. So what happens in a virtual job fair? Using Zoom events, sites are assigned a booth in our virtual expo floor where attendees can move freely, network via one-on-one chat, and join other participants in expo booths for conversation. Sites are provided a 30-minute time slot where job seekers can join site representatives in their virtual booth to learn more about the site, local community, population served, positions available, practice models, salary, benefits, and more. These sessions are typically 3 to 3.5 hours long and can accommodate up to 30 sites. Next slide, please. This slide here provides you a wealth of ways to connect and learn more about our programs, resources, and ways in which we can support you. Next slide, please. HRSA is on 5 social media platforms. We encourage you to follow along and share our content on Twitter, Facebook, LinkedIn, and Instagram to stay up to date on the latest HRSA news. Our account handle on each platform is @HRSAGOV, and visit our YouTube page @HRSATube to learn more. Additionally, we also encourage you to sign up for HRSA e-News, a bi-weekly email of comprehensive HRSA news, and to sign up for HRSA press releases. You can also visit our website at www.hrsa.gov for more detailed information about all of our programs. Next slide, please. And that concludes my remarks, and I think we're open for the Q&A session now.
Yes, wonderful. Thank you, Captain. No, that was fantastic. I love the virtual job fair too. That's I love that. Thank you so much for all this information.
Yeah, absolutely.
All right, I'm taking a look here. Okay, I've got a few questions for you. Oh, great. Wendy's adding the contact information as well. Thank you. I saw lots of information dropped in the chat box. Wonderful. Okay, first question for you, please, is if I'm not sure whether the center, the school-based health center I work in, is an NHSC site, what's the best approach to find out? And is it better for my sponsoring healthcare organization to inquire or go online and check our status in the Health Workforce Connector. So should I do it via me at the school site or through my sponsoring organization is part 2?
Yeah, sounds good. So in regards to or in response to that question, there are several ways. One could go on the Health Workforce Connector to check, and it would give you a great repository of actually all the sites that are eligible or are approved. Likewise, you can reach out directly to us. So both in the chat and then also in the slide deck, we have information also on the website. You can reach out to your local state or territorial lead, and we will be able to find that out for you. Now, the question of whether the clinician should reach out or if the host site should reach out, I would encourage you to ask your host site, the site point of contacts, who we work with very closely, and that way we can have a much more seamless conversation rather than trying to go back and forth and figure out which site you're talking about.
Absolutely, that makes sense. Thank you. If we'd like to apply to become a site, but we missed the June application deadline, do we need to wait until the cycle opens next year to apply?
Yes, you will have to wait until the cycle opens next year. So the recertification cycle that occurs in the fall time is only for sites that are currently active.
Okay, great. This is a great question, this next one. So if a sponsoring healthcare agency has numerous school-based sites and the sponsoring agency is NHSC approved, does that mean all sites under the umbrella of that agency are NHSC approved?
The short answer is no. So for NHSC sites, each site needs to submit an application. So we oftentimes do have large organizational networks where there are a few sites that are approved and others that are not. And then at which point they grow their services and they want to go ahead and apply. And so then they reach out to us and we encourage them to apply specifically for that new site location.
And actually, I think this then adds on to this. So can a school-based health center themselves apply directly? Or do they need to champion the cause and get their umbrella agency to apply on their behalf, essentially? Like, can the school-based health center level site apply on their own?
Yeah, so again, it depends on, I would say it depends on how the organization is set up and who are the assigned site point of contact. For the most part, with larger organizations or networks of sites, we see that there are dedicated site point of contacts for that organization. And so I would reach out to those sites point of contacts to inquire and have them apply.
Great, thanks. Yeah, I'm actually thinking the video that we saw today might help towards this question, but we'll see what else you might recommend. For clinicians who work at sites that are not currently NHSC approved, what's the best tactic to champion the program and share information with administrators? So that video comes to mind because that was a great example, but any other thoughts there?
Yeah, absolutely. So share the video, take a look at our NHSC website, which has a wealth of information. And actually, I would encourage you to perhaps even reach out to your state and territorial lead. We may have other resources that we can share with you. Certainly, a couple of the resources that we shared today on the webinar in the slides are the Health Workforce Connector and the virtual job fairs. I think oftentimes site administrators may not realize the sort of the comprehensive network and resources that NHSC provides until they take a look at some of these resources.
Great, thank you. What's the best way to stay informed about NHSC programs and deadlines? Is there some email listserv or something they should be paying attention to? What do you recommend there?
Yes, and I believe in the last slide or even the slide before that, we did drop a few resources for posts for folks to sign up for HRSA e-news as well as some other listservs.
Great. Couple more here. Okay. Oh, I think I know what you're gonna say in this one, but I'm gonna ask you. If our site's interested in applying for NHSC approval and needs assistance with the application, who should we contact?
You have a couple resources. So you can reach out to both the Division of Regional Operations state or territorial leads, and we'll be happy to help. You can also reach out directly, or you can reach out to us first, and then we will connect you with the state primary care office. We work very closely with those offices. They know our requirements in and out, and they help us to review site applications as well. And so they are a wonderful resource as well.
Oh, this is an interesting question. Okay, are health centers affiliated with private and public schools eligible for NHSC approval, or just public schools?
Yeah, I think that it would depend on a case-by-case basis. The primary requirement is making sure that the school-based health program provides care to the HPSA or to the population there. So it's not necessarily a matter of public or private, as we have approved both public and private. It's just a matter of the type of services and to whom they provide the services.
Thank you. And one other here that is based on the type of site. Are mobile school-based health centers eligible for NHSC approval?
Yes, we do. We do approve mobile units, and so those are eligible site types.
And then that also has me thinking, just to add on for my own interest too, how about telehealth-based sites if they're based out of, sometimes we'll have providers who are based at a main FQHC site, but their main job is delivering care via telehealth to schools. Would each school need to be a part of that, or would the main host site where the provider is sitting be considered? How does that work with telehealth, and is that permitted?
Yeah, so telehealth is permitted. Now, I will caution to say that it's important for folks to check out both the NHSC site reference guide, and then also it's very important to understand, depending on the clinicians, whether they are applying for a scholarship program or loan repayment program, to look at specifically the application and program guidances, because in those APGs, it will spell out the allowances for telehealth. It is allowable. It's not as flexible as it was during the COVID pandemic, but it is allowable.
Sure. Okay, that makes great. Thank you. Lots of school-based models out there, or hybrids, et cetera. So those were great examples of what people asked. Wonderful. Thank you. I do not see any other Q&As in. I see all our participants still on. If anyone has any final questions, feel free to drop it into the Q&A box.
And Andrea, I'll just plug again, if folks don't have any questions now, I would encourage you to do two things. One is to check out the NHSC website on the sites. So I think it's nhsc.gov/sites. We did a webinar similar to the information that I provided today, but much more drilled down for site point of contacts. We did that last week, and so it should be posting soon if it hasn't posted already. So I would encourage folks to look at that, and then also to join us on the May 25th Q&A session, where the whole hour and a half is dedicated to answering questions. So oftentimes folks may not have questions when they are viewing a webinar, just because there's so much information to digest. And then a day or two or a week later, they'll start coming up with questions. So certainly, if you don't have any questions today, that's fine, but log in and join us on the Q&A session on May 25th.
Great idea. Yes, it comes to people often afterwards. That's wonderful.
Right.
Thank you. And that's
Right.
fantastic to have that long to really dive in and ask. So that's wonderful.
Yeah,
Thank you
yeah.
so much. And we will be, as we mentioned early on too, we'll disseminate this through our archives, so that those who were unable to join will be able to take a listen to today. So that will help people know about May 25th as well. All right, well, I don't see anything else coming in, so I'd love to say thank you, Captain No, and I'll ask Harper if we want to put up our evaluation poll. And remind everyone, this will come out via email from us, the recording and follow-up resources. We will include links from all the resources shared in the chat box today within a week. So we really, really appreciate your time to Captain No and to all of you who joined us today, and appreciate you taking time to do the poll. Thank you so much.
Thank you. It was a pleasure. Thanks for inviting me.